Welcome to Ali Fitness Podcast, a weekly production all about bringing health into fitness. Welcome to another episode, and today we have a special guest, Dr. Gary Foresman. He's one of very few medical doctors who is also qualified in several systems of healing. These include Ayurveda, meditation, stress management, massage, botanical, orthomolecular, and functional medicine systems. He not only continues to grow his own knowledge base, but through his medical practice, his writings, and his informative interviews like today's, he helps everyone take control of their own health. So Dr. Foresman claimed in one of the interviews that I heard that doctors should be teachers. And I wish that was the case, but
right.
He's definitely in the minority, I believe. And today we have Dr. Foresman on the show to discuss something that until recently as an athlete, I never thought I'd actually be discussing, and that is the topic of heart disease. So Dr. Foresman, firstly, welcome to the show.
It's great to be with you. Thank you.
So I was saying to you offline, I really, I've been excited to talk to you, and I really didn't know what to talk to you about because you're so knowledgeable in so many areas. But heart disease is one of those areas, and I'm just astounded about what's happening with athletes and heart disease, and not just athletes, of course.
Right.
So obviously you know a lot about this. So how prevalent is heart disease, and who's most affected?
Right. You know, in reviewing some of the questions you sent to me, for the most part, I know the data in America, so I'm going to assume that Australian medicine is very similar that way because there's a lot of crossover in terms of some of the Australian medical journals that we get online as well here too. So the numbers do seem to be similar. And for everybody out there, when we're talking about heart disease, we're specifically talking about coronary artery disease. It's really blood vessel disease, specifically the coronary arteries. And, one of the fathers of internal medicine said a man is as old as his blood vessels. And that was back in the day when you didn't say a person, you said a man. But anyways, and it was really quite prophetic from a standpoint of, looking at people's vascular health as an overview of their overall physical health status and being a predictor of not just cardiovascular mortality, but overall mortality. So coronary artery disease specifically, because there's many types of heart disease, which we're not going to be talking about today, arrhythmias and valvular heart disease and all kinds of other things. But when most people say heart disease, and I'm assuming that's what you mean as well, we're talking about coronary artery disease, right?
Yes.
And in terms of who it's affecting, it's basically everyone. Everybody's getting older, and so even as an aging athlete, not that you're aging, I actually don't know how old you are. Sorry about that. But we're all getting older every day anyways. But so coronary artery disease affects pretty much all of us because it's an aging process. Period. And so it's more accelerated in some people than others. But just like as an athlete, a runner has more accelerated ages, say, for instance, of their knees and their hips than somebody who's a non-runner, just because, as the saying goes, it's not the years, it's the mileage, right? So for some people, they're developing more mileage in their coronary arteries. And the difference between osteoarthritis of the knee and coronary artery disease is one can really kill you, and that's the coronary artery disease. So it's a subject everybody has some interest in, and especially when it looks into the mainstream medicine is what do we do to prevent it, and so what are the risk factors and who are the questions that you have, and outside of the generic thing, everybody, one of the first things I would tell everybody across the world is that there's a screening test available for coronary artery disease, and everybody, and I tell every man over 45, every woman over 55 should do a test called a coronary artery calcium score. Okay, this is an ultra-fast CAT scan of the coronary arteries, where the person gets into a CAT scanner, they get hooked up to an EKG, so photographically your heart will be standing still if they time the slices right, and we can image your coronary arteries and we can look to see who is developing coronary artery disease early in their life. Okay, and so the first thing out there is, as we get older, everybody should be screened for heart disease because the standard risk factors that most doctors even still use in our country, it's called the Framingham Heart Studies. The data from before the 80s are almost irrelevant in today's world, and we can talk about why that is in terms of what numbers doctors are using to predict cardiovascular risk, when they really shouldn't instead be predicting whether you have this problem. They should be finding out whether you have this problem, and it's now doable. The treadmill tests of the old are pretty much not being used anymore because they're not good screening tests, and this is one test that we should do on everybody. Or if you have a family history of heart disease, a first-degree relative, meaning a sibling or a parent who had early premature heart disease. Premature heart disease means if you, say, for instance, have a male in your family who had heart disease at 55, even if they're a smoker, you should start maybe even screening as a male at 35 or as a woman at 45, because you are obviously have a higher risk because they develop premature coronary artery disease. And again, premature coronary artery disease, some people define as age 45 or under. That's fairly rare. But if you have a family history of premature heart disease, you should get this test even earlier than the numbers that I gave you. And it's the single most important risk factor assessment anybody can do. Remember, this is a test. It's not more important than eating right, people. But I'm just saying in terms of testing, because it's you hear time and again where somebody said, nobody could have known he had heart disease. And everybody can know if somebody has heart disease if they just test for it. And this test should be available to anybody who is wondering whether or not they have coronary artery disease, especially if some doctor out there is trying to put you on a statin drug for your cholesterol, when those drugs are treatments to treat heart disease, not to treat high cholesterol. Sorry if that's too much information, but
no, let's break that down.
Is so important.
Yeah, no, let's break that down. So this calcium score, what are the chances, and I guess it's hard for you to talk about any other country, but so let's just talk about America. What are the chances of me going in, let's say I'm 45, and that's sort of the typical age that a woman should get this screening, and I go into the doctor and I say, look, I think I need
screen at 50.
Sorry, 50, is it?
I screen at 55. Not it's 45 for men, and then 55 for women is when I start screening. Earlier, if there's any real reason to screen earlier, like a strong family history.
Okay,
Sorry.
so potentially there's a strong family history, and so then I go in at 45 and say, okay, I think I need a calcium score test just to see, if I potentially have a problem. Would the doctor most likely agree with me, or would he suggest another test?
Well, fortunately, where we're at, you can just order these things. You could go into a local radiology facility, and I've worked it out with a local place, and they do them for $99, which for a screening test is ridiculously inexpensive for something as important as this. And so you can even do it without a doctor's order if you just know about it and you ask a local radiology facility, because they make money doing it. They don't mind doing it for you. How it goes there, or whether you have to have a doctor's order in Australia or not, I don't know. But how likely would your standard doctor in America be? And the answer is, I have been ordering this test for over 30 years now. When I did my residency, I've been a doctor for 30 years now. And when we were doing my residency, we were working with some of the people at UCLA. Sorry, that's the University of California at Los Angeles. And in terms of some of the early studies on coronary calcium scores, and even back then, I knew it was a very powerful tool. And so even though I've been ordering this test throughout my entire career, and the technology is better and the results are better, by the way, but they were still darn good 30 years ago. So this is a test that's been around for decades, okay? And every doctor should be doing it as a primary care and using, and if they wanted to do it even earlier than I'm telling you to do it, but this is something everybody should be getting done, because the cardiovascular disease, as we know, is the number one killer still. Cancer might be passing it, by the way, but it's still tough enough, and important enough a disease that everybody should be screening for it. But will most people's doctors order this? And the answer is no. And you know how I am about this, Ellie, if you've listened to my other interviews, is that there's a lot of pressures by doctors to make sure they prescribe medicines, okay? So the most of the criteria for being a quote-unquote good doctor in our country is basically, if a person has high cholesterol, you just give them a statin drug, period. And it doesn't matter whether they need it or not. And the idea is to determine whether you need it or not. And so, and this test would help determine that. So there's a lot of forces to not do the test because it would decrease the amount of prescriptions that are being given. Therefore, it's not a good test if you look at it from a pharmaceutical industry perspective.
Right. So is that why then more often than not I hear people getting their cholesterol tested?
Correct. Because people in our country have equated cholesterol and heart disease, and it's one of the great myths of all times. But the classic saying, "Any good lie has some truth to it," because there is some truth to it. This really dates back to right around 1980, where the entire kind of the capitalistic world kind of went crazy in terms of trickle down economics, all the way down to this phenomenon, which is the statin drugs came out. We needed to get people to take a drug. You need an enemy. So the enemy became cholesterol and saturated fats. So you declared an enemy. This is our enemy. And if to fight this enemy, you need this weapon, statins. Okay. And so at that point, everybody became afraid of fat, as you probably well know. It was really the late 70s, but it really kicked in as we head into the early 80s. Okay. And so at that time, we made this enormous mistake in our country about blaming fats for everything when it was 100%. Well, you can't say 100% wrong because, of course, hydrogenated oils and vegetable oils, which people started to use more of, really are quote unquote bad fats, of course. So it made this huge mistake. And at that time, the cholesterol profile, when I started my career, by the way, a normal cholesterol, if you got it from the lab test, was anything under 300. Now, if your LDL is over 100, I'm sorry, the LDL is low density lipoprotein. They often call it the lousy cholesterol, is over 100. The doctor's already trying to put you on a drug. And it's really quite interesting in my 30 years, how much the view of cholesterol as an enemy, as fats as an enemy, is still taken over. And even our world, that's not necessarily true. I'm talking about the paleo world in general. We know it's not true, but there's still a whole lot of forces out there, fighting against this idea that fats are good for you. And so, subsequently speaking, and why is this relevant, everybody? It's because you have to have an enemy. People in the world, they said, did you get your cholesterol checked? Because it's on TV, it's on the TV advertisements, and they've equated high cholesterol with heart disease when it's a very minor risk factor. Maybe 10% of coronary artery disease can be explained by disorders of lipid metabolism. Abnormal cholesterol profiles. So it's a good lie because it's somewhat true. And there is a role for some of the statin drugs, by the way. I'm not trying to come up as an anti-statin doctor because I'm not. I'm for the appropriate prescription of any medicine sometimes, but not the wholesale prescription to everybody to treat a number. But anyway, so the world became afraid of cholesterol, and the doctors are still measuring these cholesterol profiles also from 30 years ago instead of the more specific profiles that we have available today, looking at better breakdowns of the small dense LDLs and the types of HDLs, etc. So the movement in standard HMO medicine and standard, kind of the simple 5-minute off doctor visit is to get a simple cholesterol profile. If your LDL is over 100, you go on a statin drug like that, which is really, once again, a treatment for heart disease when you aren't treating heart disease at all, but you're just treating a cholesterol number. And it's a sad, sad state of affairs.
Interesting. So would you suggest if your LDL is, well, obviously not 100, but say much higher, would you suggest that does need addressing, or obviously not necessarily to do with heart disease, but in general?
Right. I love cholesterol profile, just so everybody hears that. And cholesterol as a sign of your healthy metabolism is an awesome test. Okay. So I measure cholesterol profiles in nearly everybody, unless, I have a lot of patients in my practice. They've had great cholesterol profiles a few times. I stopped measuring it because unless they do something dramatically different, they don't need them all the time. But the reason you do cholesterol profiles all the time is to see, it's a great measure of compliance. You can tell how well they're doing with their paleo diet, right? You can just order a cholesterol profile, and I know before they go through the door whether they've been doing it as well. And I can tell whether they're taking their supplements. I can tell almost everything about them by their blood tests. And of course, because so once again, everybody out there, the idea is that the human being is complicated. And if you have a disorder, the saying that I say to everybody, which is our symptoms are our teachers. In this case, high cholesterol is a sign. So our symptoms and our signs are our teachers. So it's not the doctor that's the teacher. When you get your labs back, it's not your doctor. Those labs are you. And these are your labs talking to you, and they're telling you about you, and I'm the interpreter. Because most people don't either know how to interpret their labs, or if they do, sometimes they misinterpret them based upon what other doctors have told them to think. And so these labs that your doctor gets for you is you talking to you. And if your cholesterol is going up, because this is the funniest thing, people will have a high cholesterol, and let's say 5 years ago it wasn't, and they'll say, "Oh, don't worry, it's just your genes." Like somehow your genes changed in the last 5 years. So what a great piece of information to say, "Well, gosh, my cholesterol went up," and it should spur on such interest from your doctor. Okay, why did the cholesterol go up? Of course, we think lifestyle first. Of course, nutrition and healthy exercise. How are you doing there? What are the healthy alcohol behaviors? How are you doing stress-wise? You can find out why somebody's cholesterol profile is becoming adverse, usually by talking to them, okay? But then if you don't find it there, then you look, wow, what are their thyroid functions? Oh, their cholesterol is off because they're hypothyroid. So let me use that as an example for everybody. I see people all the time who went on a statin drug for their high cholesterol. Nobody ever looked for why, and they have all these underlying problems that have been missed because they didn't learn from their teacher. The drug is there to kill the teacher. Okay? So if you just say shut up to your teacher, meaning you take a drug and you change your numbers, you're not learning a darn thing. And what we're wanting to do is learn. Another thing that in our country, learning has just been almost exiled from the country. Um, so subsequently speaking, people don't seem to be interested in figuring this stuff out, almost in an epidemic way, because what a fascinating thing to find out about yourself. Get a cholesterol profile, and let's say it has gone awry. What are my endocrine function status? What's the inflammation level going on in my body? How's my homocysteine doing? How's my vitamin D? How are my sex steroid hormones doing? Because cholesterol is the basis of your steroid hormones. So what a common cause for your body to upregulate cholesterol production in response to a steroid hormone deficiency. So you correct the underlying steroid hormone deficiencies, and subsequently speaking, the cholesterols get better. So,
but Dr. Foresman, you're just making it difficult, because isn't it much easier just to go, oh no, you're having too much saturated fat, let's just lower the cholesterol, get on these statin drugs, and be done with it?
Yeah, I complicate things. I complicate patients' lives. It's my job, and so I like easy when it works, but not this doesn't work.
Yeah.
Okay.
So with the calcium score, what do you look for, and what's an example of a patient that has had a high score? What was that score, and how did you treat it?
Well, so like we started off, so the first thing to do is recognize that everybody has some risk for coronary artery disease, independent of their cholesterol. So, and remember, if you have a high cholesterol, before you even take a drug or an herb, okay, please see if you have to even treat it, because high cholesterol in and of itself is not it's a sign of the problem, not the problem, the vast majority of times. Now, that's a few caveats. There's some familial type hyperlipidemias that do need treatment all the time. They're genetically related. Those are not the ones we're talking about. I'm talking about the general population. So back to your question. So we get, what should a coronary calcium score be? And the answer is 0. Okay, you want a coronary calcium score of 0. But if the score is anything more than 10, then it certainly should have some intervention done, which is a full cardiovascular risk assessment to see how much you should treat this. Now, going furthermore into what your question is that the idea always, if somebody has coronary artery disease, and I'm sure you've heard this number, something like 50% of people have normal cholesterol profiles, depends on how you define normal, but basically normal profiles, but they have significant heart disease. And I've had treated patients with coronary calcium scores anywhere from 800 to 3,800. Okay, so so they have severe coronary artery disease, and of course, everybody, the more severe the problem, the more aggressive the treatment. And yes, and be very clear, if somebody already has critical coronary disease means they've already had a stent placed or bypass surgery, we're into the secondary prevention mode, then in those cases, that's when you can make the greatest argument for the statin drugs and other things, okay? Because they've already shown they can have complicated coronary artery disease. And if they can't get right on the lifestyle issues, And as you probably are aware, getting people to follow healthy lifestyle is really difficult for most doctors, especially with 5-minute office visits. And so what do you do when you find you have this coronary artery disease? The first step, I hope you don't. Okay, so I've had several people come into me and say, I want to go on statin drugs, but they have calcium scores of 0. And I go, why would you want to do that? Why would you have a treatment for heart disease when you don't? Because remember, statin drugs are treatments for coronary artery disease and for other vascular diseases, but they are not treatments just for high cholesterol, even though we know they lower cholesterol. So, and I'm sorry if I'm focusing on statins, but that's the main thing that everybody seems to be getting put on these days, especially if they see the cardiologist, which is, why I actually tell people, if you walk into a cardiologist office, their basic belief system is everybody should be on a statin drug. And I do mean everybody. So if you walk into a cardiologist's office, and that means across the world, from what I can see, you are asking, almost demanding, to be put on a statin drug. You're not asking to get evaluated for your coronary artery disease. You're demanding to be put on a drug or get a procedure and a drug. It's drug always, okay? And drug and procedure actually a good chunk of the time. So, because people get upset with their local cardiologists around here because they went to the cardiologist and of course they put them on the statin drug. And I said, you walked in their door, you were demanding you get on a drug. So don't be mad at a cardiologist if they put you on a statin drug. It is part of their current belief system. And so, but what I do is I do a full assessment of their endocrine functions, their thyroids, their sex steroid hormones, adrenal functions. I look at all of the inflammation indices, tests known as C-reactive proteins and fibrinogens and all these other factors. I look at their fish oil index. I look at their CoQ10 levels, their vitamin E levels. I look at all kinds of things to figure if there's something we can do that corrects their underlying health. Now, remember, everybody, of course, the foundations of health that I tell everybody about is paleo nutrition, which I'm sure your audience knows entirely about, healthy exercise, and not over exercise either. We all know that over exercise can cause as many problems as under exercise. Okay. So, and of course, stress management, that's my number one thing, seeing the world as it is. And of course, getting adequate sleep. All these things affect the primary, and this is where we want to go. The primary cardiac risk factor is actually diabetes and the metabolic syndrome. Okay. You are probably aware that somewhere between 65 and 70% of Americans are overweight and obese. Almost entirely, that rate has doubled since 1980. Since, once again, we demonized fats and we started using these drugs. Another common cause of diabetes is actually statin drugs, by the way. Statin drugs are very good for business.
Great.
And so on that order, what a great, this whole process that you should have with yourself, but hopefully with the guidance of a doctor, is like, wow, I have something out of whack here. I really ought to get to the reason why this is here instead of just saying no to it. Because, back in 1980 was the legendary Nancy Reagan era, and just say no to drugs, which was, again, one of the more horrible pieces of advice ever. And I'm not just saying you just say no to this drug. We're trying to actually get a reason. Why do we do drugs? That's the question, not saying no to them. And why do we have high cholesterol? Get the inquiry back in. True Western medicine, Greek, Socratic, Platonic, Aristotelian, all our natures really are to question things. And so, gosh, what a great thing to start questioning more. I love being questioned. I really do. I mean, there's a way to do it. It's not about being an arrogant jerk about it, but, we're just talking about let's question ourselves. And so what a great journey to go on if you have an imbalance, to look for the reasons for it and then treat your individual reason for it. Another common question, I'm sorry for all the riffing, you can shut me up if you want to. But people come to me and say, what is the diet for cancer? What is the diet for heart disease? What is the diet for any autoimmune disease? And I actually tell them, what a sad question. Is that, nutrition treats people, not diseases. Everybody's heard me say this eventually, which is true fundamental of non-Western medicine. Western medicine, I'm talking about MD kind of medicine, which is we treat diseases, not humans. Humans are what gets in the way of us treating the disease, actually. And so, whereas natural medicine is supposed to treat you, we diagnose the person, not the disease. We look for imbalances in things, but the real key here is that the nutrition treats the person. The person is supposed to individualize and start with the real food. The reason everybody asks why do I recommend paleo diets is from one standpoint it can't be wrong, which is to eat real food and cut out processed foods. And whether you find that you're more of a vegan or more of a carnivore, let you determine that, not me. Okay, how do I feel with what do I eat? And that will, through the transitive property, if you treat you better, you treat the heart disease better. This idea that every person with coronary artery disease gets the same diet is just frighteningly simplistic, because it doesn't even make sense if you even stop for a second to think about it. Why would you think that you're a disease and I need to treat that? You're a human being who happens to have coronary artery disease. Treat you. Okay, and don't get too caught up. You might do better with juicing. You might do better with the, if you listen to your body, it is willing to tell you. And then I'll measure the tests, and and they'll tell you. I had this great couple the other day in the practice. They'd gone to more like coconut oil and more paleo, and it was what a perfect representation. The guy felt great on the system and his numbers were absolute perfection. Everything had changed and gotten better. She felt miserable and every lab had gotten worse, eating basically the same diet. And it was paleo variant. I think they were just, the main issue is some people do great with coconut oil and some people don't. She should have known she wasn't doing well already because she felt like crap. Sorry, not so well. Um, but the labs did confirm that. So what does that mean? She needed to modify her diet and eat differently than him. So once again, make this journey the best form of exercise, the one you'll do. But if you have an imbalance here, if you're willing to actually treat the classic American issues, which is stress, lack of exercise, horrible nutrition, you will actually treat the underlying problem so much better than the statin drug. Everybody makes a big deal about going on the statins, when especially if you look at the better studied diet really is the Mediterranean diet, especially the Mediterranean unrestricted fat diet. The outcomes of converting to a Mediterranean diet versus a standard American diet far surpasses the benefits that you get from going on a statin drug. So why isn't it being routinely prescribed, right? Doing something like it. So the idea is you take this journey, you find out, by the way, if you have a coronary calcium score of 0, it's not blow off your cholesterol profile. It's just you have a longer time to intervene and saying, I wonder if I can normalize this. And going back to the diabetes part of it, everybody out there should have at least these tests done outside of your lipid profile. They should have a test called a hemoglobin A1C. The hemoglobin A1C is called the diabetes test. The hemoglobin A1C should be under 5.2. Almost no lab says that. Some labs will say if it's under 6.5, it's fine. But under 5.2 is perfect. Over 6.0 is truly diabetes, okay? And your risk of having a heart attack from 5.2 to 6.0 is 2.5-fold higher within what most labs call the normal range, okay? So actually, sure, hyperglycemia, meaning your blood sugar elevating, even before the doctor will call it a disease, is actually truly a disease, and the single greatest cardiac risk factor we have. So we should have an A1C done. And by the way, glycation is one of the primary mechanisms of aging. So like when we started off, remember, coronary artery disease is just a way your body ages. Okay. And that's all it is. And sometimes it age is, we all know, sometimes my hairline aged faster than a lot of me. So we all age kind of like at different rates, and so some people's coronary arteries, will age faster than the rest of them. So they're being more affected by these numbers. And so they should have a hemoglobin A1C, and they should do everything that they can with their doctor to get it under 5.2. They should have the highly sensitive C-reactive protein, CRP. That's the inflammation test. It should be under 1. Once again, what is the next primary mechanism of aging of the human body beyond glycation, meaning abnormal blood sugar, the A1C, is inflammation, the CRP test. What's the next test? And remember, this is in addition to the standard lipid profile. I prefer more complicated lipid profiles, is have a marker of methylation. Methylation is methylatation, methylation called homocysteine. Homocysteine is a marker how well you're doing with this basic metabolic process called methylation, which is primarily related to B vitamins, some to inflammation and things, and that should be under 8. Okay. And so if we can control those risk factors, and trust me, there's tens and tens of others that you could look at and make an argument to measure as well. But if you can get those things done, as well as correcting unhealthy lipid profiles, mainly through lifestyle, but also kind of answering your question earlier, lifestyle first is my first approach. And then after that, then there's things like fish oils, there's things like vitamin K and vitamin D, correcting other, anti-inflammatory things, curcumin. There's so many ways of improving and treating you without poisoning. So, when I go into this, the father of pharmacology said, all medicines are poisons. It's just a matter of the dosage. The HMG-CoA reductase inhibitors, statin drugs, poison, and they really do. They block, they irreversibly inhibit the most important enzyme in the mammal system. Okay, so now that is some very interesting Russian roulette to be playing. Is that why would you block your most important enzyme in your body for the rest of your life? Especially if what you really needed was to treat your thyroid or all these other things. And be very clear, people, these drugs work 99 point whatever percent of the time to lower LDL. They do lower the numbers. That's not the question point. Is will you lower your numbers, have an improved outcome or a worse outcome? And that's such an important question. But please approach the other things first. And on occasion, now, please hear this, everybody. If you have had an event recently, meaning you have unstable angina, that's chest pain associated with coronary artery disease. If you've had a recent stent placement, which is the little tube they put in the coronary arteries, bypass surgery, a heart attack, statin drugs are life-saving. Okay, I would take them if I could tolerate them. And once again, the statin drugs, and I would take as high a dose as I could tolerate. Most of the studies indicate if the person doesn't know they're on a statin, they get almost fewer side effects than the placebo. So this idea that statins are uniformly horrible is just not true. There is a public perception that they're evil, but their rate of side effects really is very similar to placebos in trials. So
Doctor,
yes.
Can I just confirm then? So obviously you would have a look at the calcium score and
Yes.
you do several other tests, like, for example, the 4 tests. You mentioned 4 tests, and that I'm assuming is the lipid test is the 4th.
Correct.
For the diabetes. So you do those, and let's assume for argument's sake that the diabetes, all of those tests looked okay. And there was I shouldn't say just, but there was a definite high calcium score. Obviously, there's different stages. So firstly, what stage 1, what stage 2? And then at what stage would you move past the lifestyle and like sleep, nutrition treatment and move on to potentially drugs, or would you not?
Right. Well, there's a time and a place for everything. And so classically, you break down the coronary calcium score this way. 0 is perfect. Okay. And for the most part, it rules out significant coronary artery disease. It's a calcified plaque that we're measuring on this. So you can still have soft plaques and premature coronary artery disease, meaning things that don't have calcium on them, therefore they don't show up on the scan. But it does rule out significant blockage. From 1 to 10 is considered insignificant. From 11 to 100 is mild coronary artery disease. From 101 to 400 is considered moderate. Okay. From 400 to 1,000 is severe, and over 1,000 is very severe. And so now, if you look at those criteria that I just gave you, I really look at anything over 10 as being significant, meaning if I can't get numbers appropriate, then my step often will include and these are 2 very important agents, which is on a primary prevention basis. We've done everything we can lifestyle, and we're still having, and one final thing, another assessment is to do the coronary calcium score in 2 years to see, are you slowing the progression of change? Okay. Did the interventions you do make a difference where your coronary calcium score is going up slower than would have been predicted otherwise? Okay. And there's ways of checking that out. And then eventually stabilizing. It's lovely to say that we want it to reverse, which of course we do. It's just very difficult for most people to get their coronary artery disease to reverse without making more efforts than most people do.
Is it actually difficult, or is it impossible?
It's difficult, not impossible. Okay, I've had several patients who've done it, and so including going from hundreds down into the teens, and some people from going in the teen 30-40 range to having zero, no further identifiable plaque. And so no, it's definitely doable. And so, Dean Ornish, this is the poor guy when he was back in the 70s where everybody was focusing on fat. He had this, vegan diet, meditation, and exercise, and he had some reversals as well. Nobody could reproduce his results, but nobody seemed to rally people around to do his system as well as Dean Ornish could. Unfortunately, Dean and a lot of his group that followed him still got stuck on the no fat mythology, and that's why they're unfortunately once you've identified yourself as being a something, meaning a no fat guy, you seem to be stuck with that for the rest of your life. And so he's still trying to cling to those low fat diets and things, which is unfortunate for him. But with all respect to him, he seems like a very nice man. And so, but on that order, you can get it to reverse, and let's go into that program. That's why so we focus on these physical things. My number one thing that I can get people to do individually or collectively as a species is learn and practice meditation. Stress is, in my perception, the primary driver of why people do the unhealthy things, subsequently leading to the heart disease, let alone the studies indicating that a type A personality, specifically a subsection called your hostility index, is truly associated with coronary artery disease. So is the primary driver in today's world. And I think everybody sees it that, we have this entire news network dedicated to fear and hatred, and it's sweeping the country, and it's led to such horrible things. Is that our primary driver of disease today? And everybody who's ever heard me talk says I think the primary vector of disease days is the Fox News or whoever's going to take their place now that they're getting, sexual assault network and all the rest of those things. So when people listen to that kind of fear and hatred, they are driving this mechanism by which they are losing intelligence, they're becoming tribal in nature, and subsequently speaking, they go back to all the behaviors that they need to treat themselves for feeling so much fear. Okay, so why do people go back to drugs? Why do they go back to the bad diet? Why do they stop exercising? And it's always about stress and this misperception that comes by taking ourselves out into a world of fear when the best place to be is in silence. Okay, learn and practice meditation, everybody, because it is the one true way throughout entire histories that we've always been able to find out what is the isness of the world and how do we connect with love and kindness. We all know the heart chakra is where we think of our interconnectedness with others. And do I feel that the heart chakra has taken a beating like nobody's business, especially over the last few decades? And so the answer is yes. And from my perception, and I of course have no research on this, but from my perception, I used to have sweet little old ladies in my practice. Now they're just all angry, and the little old men as well. And so so what is going on there? And I think there's this huge misperception of reality that is stoked by an information system meant to keep us in fear and hate, and seeing each other as different, driving this thing they call personal responsibility, which is basically being cruel to your fellow man. And that cruelty manifests in a hardened heart. Okay. And if we can just open up our heart, whether you think of chakras or not, and how do we do that? We become human again. Okay. And so we're all human. It's just, do we have humanity? Do we upregulate ourselves to a level where we're just being and we can be with everybody? And again, including the people who don't like us. Can we be with all of them, not just the people who are like-minded, and share that love? Because in the end, this heart disease that's kind of really constricting people's hearts, I think not just metaphorically, I think the stress responses leads to people not taking on the behaviors that are healthy for them because they feel so stressed. They go back to their kind of antique behaviors of childhood, and gosh, I just need ice cream, or if they, the more adult things like I just need to overdrink or sit on the couch all day and watch, binge watch some TV show. And so subsequently speaking, what will drive our consistency with this loving nature that we're all trying to cultivate is spending time with a meditative practice. Okay. if there's anything else I can, I know those tests we just talked about are important, but those are the physical self. Your interiors, everybody, is so much more important than your exteriors. And giving it the same degree of attention, you're whatever kind of athlete you are, yes, give your physical body attention, but that inner beautiful you, it needs loving attention too. And that's where having meditative practices are so important. This yin and yang of cardiovascular medicine, we need the beingness to balance the doingness, people. And can we have a healthy heart if we're in fear or anger? And I really don't think so. Sorry, and that is definitely a personal perception, more so than I'd call it a medical fact.
And Dr. Foresman, do you find that stress is any type of stress, whether it be, say, over exercising and causing stress on the body in that way, do you think the body can actually differentiate between different types of stress, or any stress could potentially cause calcification of the heart?
Any stress can, because some of the basic responses to like true exhausting exercise, so I find triathletes to be really impressive, but that's tough on your body. There's just no way around it. But do I recommend that kind of athletic endeavor? And the answer is, I guess for the few who can make a living doing it, maybe, but I wouldn't. As we all know, most athletes have a shorter lifespan because it's so demanding on our bodies. And so, subsequently speaking, that's yes, those very severe physical stressors can affect you as much as being in a bad relationship, 24 hours a day. So that's why these interior things are so important. Nobody's going to be healthy if they're in an unloving relationship or an unloving job situation. Can they align? This is one of the things I've been working on with myself, is do my actions align with my belief systems? And so if I believe this to be true in the world, so when we talk about that, is that people want, they want an end to terrorism, but this is especially true for women. And this is, I promise, relevant for the heart. They are self-terrorists, especially true for women, because the world is telling you you're not pretty enough, or you don't work hard enough, or whatever the world tells you. You need more cosmetics or bags or all this. Capitalism is basically driven based upon making especially women feel bad about themselves. So they become their own self-terrorists. Their own inner conversation isn't kind to themselves. And so we want people to be not just kind to others, kind to themselves. And if we can learn that inner kindness, then we find that we naturally choose some exercise, but we probably don't kill ourselves with exercise. We find that we have some stress distractions. We have a drink here or there, but we don't overdrink. And then we become these conscious choice maker, which is, in the end, all of this stuff is just supposed to drive happiness, right? So, and we all talk about having a happy heart, right? And yes, the coronary calcification is, of course, a sign of a hardened heart. I mean, that's not just metaphorical; it's actually true, right? And so is this hardened heart that we see in the world today manifested this way? Yes. We have better drugs than we used to treat it, mind you, and we have better procedures to treat it. So people are living longer with coronary artery disease, but are they happy because of it? That's its own question.
So you get a client, say, and they look, maybe they're mild or maybe even severe. Let's say they're severe and they're like 401 plus,
right,
or up to 1,000 you mentioned. So would you, obviously you'd implement these and you'd encourage them to take on meditation, sleep, nutrition straight away.
Right.
Would you also prescribe supplements and or drugs?
Yes. I do, of course. And so, most of our supplements are going to be based upon the laboratory evaluation, right? Have we gotten the vitamin D level into the 70 to 90 range? Have we gotten the omega-3 index through fish oils in this 10 to 12 range? The homocysteine, have we gotten it down? I mean, remember, we're going to be correcting all these parameters, hopefully through lifestyle. If not, then of course through supplements. And then you can make an argument for everybody, even with a coronary calcium score greater than 10. Let's start at the mild levels of coronary artery disease, to go on red yeast rice extract. And then most people out there know that red yeast rice extract is where the statin drugs came from. It's a Chinese herbal extract. It's literally a fungal extract that grows on rice that has many components, phytosterols and other components, that have proven benefits, not just in improving cholesterol profile, but in helping prevent heart attacks. And there's a kind of an ancient saying about herbal medicine, which is the pharmaceuticals will take out the intelligence and leave the wisdom behind. So the most powerful part of a red yeast rice is the statin component to it. but is much more than a statin. It has components that modify the toxicity of the statin component, making it a safer version. There are trials within Western medicine showing people who do have intolerances to statin drugs, which do exist, of course, will do well with red yeast rice if it's a blinded trial. And so I start them on red yeast rice from 1,200 milligrams a night to 1,200 milligrams twice a day. That's profoundly beneficial from a cholesterol profile. And I really combine it with an aged garlic extract called Kyolic. Kyolic is the one that has the research, and on my website I have articles on the red yeast rice and the aged garlic extract. They're several years old, but they're still valid. And so talking about how they delay the progression of coronary artery disease, especially the aged garlic extract. The one I use is called Kyolic Reserve. It's a capsule twice a day. I have no financial interest in any company that makes any of these things, by the way. And so on that order, those are my two classic treatments for their heart disease. Now, let's not forget the obvious. We, of course, have worked on smoking if they're a smoker. We're treating their blood pressure if their blood pressure is too high. My definition of an average systolic blood pressure, this is in the evening between 6 and 10 in the evening, that you do at home, obviously. If your average systolic blood pressure is running over 145, I would first of all consider natural therapies, then I would consider drug therapies. That's its own show, by the way. So, so yes, we would treat their blood pressure. And so we not forget the standard things. We can control their A1C as best as we can. So remember, all those things. And if I can get people to do that, we can slow the progression of their coronary artery disease. And be very clear, every doctor, will present their, exceptional cases. I could do some case presentations that would make myself look like this quote unquote great doctor, which doctors never do anything. We're just catalysts to help people heal themselves. Everybody heals themselves. So no doctor ever really does anything. And that includes me. We just fool people into giving us money.
I don't know. I don't think you make much money by telling people to go and sleep more and meditate. I don't think you're making much money from saying that.
You really don't know. So it's much more lucrative to do the other things. So, or become a speaker for one of these companies, because that I would be great at that and make I really would. But that would be so unethical and against my own belief systems. But I could do it.
So if you were to get a severe patient, would that, apart from the natural extracts that you'd probably also give them, what else would you do?
So we control those things. Then the next level of thing that I use, so there's other natural extracts. So there is a B5 derivative called pantethine. I use that to control cholesterol profiles. There is the turmeric, which is also very good if there's higher inflammation. There is niacin, which is very good if there's high triglycerides and low HDL. So I try to control through other supplements first. But if you have significant coronary artery disease, especially over 400 on the coronary calcium score, and I can't get the numbers down, I do use statin drugs. And I use them in combination with CoQ10 because, as much as I don't want to admit it, there is a world of research that shows that yes, you can poison yourself at least to long-term lower risk of cardiovascular complications. And as much as I sometimes don't even want to believe that to be true, if I'm going to maintain my scientific integrity, there is enough evidence that taking statin drugs, even in a primary prevention state, primary prevention meaning the coronary calcium score, we know you have heart disease, but you haven't had an event yet. You don't have chest pain. You don't have any evidence that it's clinically affecting you. And I can't control things, then absolutely I will use those drugs. If I have too high a blood pressure, I will use an ACE inhibitor. I'm an internal medicine physician too, outside of all the other things I know. So I would use an ACE inhibitor. I might use a low-dose beta blocker. Aspirin in the people with hypercoagulability, that's its own subject. So, remember, there are definitely ways of using medicines to help people, especially the ones who aren't helping themselves as much. So let's be honest. So most people, if they really can dedicate themselves to paleo nutrition, which is very difficult for a lot of people. And, as a Western doctor, remember, most people are used to coming to me and just getting drugs. So the idea of a doctor talking to them, even about their nutrition, let alone this meditation stuff. And, and obviously all the stuff I say is controversial about whatever party political party they belong to or whatever. But I need them to tune out the fear and hatred, first of all. I don't have a chance to get them to do these other things. And so talking about those things, of course, becomes that's what you're supposed to do as a physician, is talk about healing on every level. Okay. Because integrative medicine really isn't about, let me give you a cool herb and ignore your problem, as compared to giving you the drug and ignoring your problem. which is most people's view of integrative medicine, by the way, is, I really don't want to deal with that. I want to eat whatever I want and take red yeast rice. That's not what I'm looking for in a patient. you
Mm.
know and so many people's view of integrative medicine is just taking an herb while ignoring the problem versus taking the drug. Once again, I have very little interest in that, and I'm not saying that's wrong. Okay, just like the people who just take drugs and move on, it's not about right or wrong. It's just not a methodology that I would be part of. And so yes, I do use medicines even in a primary prevention basis if there's evidence of significant coronary artery disease and we're not correcting the numbers the way we need to. So yes, there's a time and a place for medicines. But remember, most people just would have gone on the drugs first and foremost without evaluating, say, their testosterone levels in men, their hormone levels in women, their inflammation levels. Most of the thyroid, of course, I almost forgot that one. And we correct that. Most of the times you can get tremendous labs and you can get evidence because remember, we're going to monitor. Is the coronary calcium score improving with what we're doing? And if it is, then substantially speaking, then I know that we're doing the right thing. If it is not, then we're missing a variable, obviously, okay? And I might have to be more aggressive at treating it because this is some serious stuff, right?
Mm.
And so absolutely, I do use those medicines, and when I say I might be wrong, everybody might be wrong. So I might be wrong by not using them earlier. I don't think so. I might be wrong for using them at all. But one thing I'm clear about in secondary prevention, once again, secondary prevention is an event has occurred already. We want to prevent a second event. There is very clear reason to use them at least for 1 to 3 years after the event. The surgery, the stent, the heart attack. There's unequivocal data in that setting to use statin drugs and then, of course, correct everything else the way we've been talking about. But what I do also is, outside of really trying to get people to deal with their interiors, which, by the way, I send as many people to psychotherapists as I do to cardiologists when I find out they have heart disease. So be very clear. The interiors need to be dealt with as well, but we, of course, deal with the exteriors as well.
Great. Look, that is an awesome summary. And as you mentioned, we can't cover everything, but I think you've given us a really good idea of what we should do and how we can prevent lots of different diseases, especially through lifestyle and meditation and all those things. So thank you so much, Dr. Foresman. And before I let you go, just to summarize, nothing to do with, well, it actually does. Little personal question. Do you have a tattoo?
I do. I have a couple, yes.
Tell us about them.
Well, I've always had a strong attachment with dragons. So my first tattoo is this beautiful black dragon, which is one of my spirit animals. And so concordant with that, that takes up most of my right upper back. And I have a beautiful phoenix that is his lover as well. And it's very much the yin and yang of medicine because, truly especially from a more Vedic standpoint, the dragon is really a sign of spirituality, healing, and enlightenment. The phoenix, of course, of regeneration, rebirth, and healing. And so they're very much healing symbols and they're eternal. Most of my back is made up with, my spirit black dragon. And then, of course, this is a very multicolored, very beautiful phoenix. And it's a symbolic, really, of my healing journey and this integration of yin and yang, of Western and Eastern, but from a deep mythological standpoint. Yes, they're very much a part of me.
Wow, that's amazing. I would never have guessed.
Yeah, well, I mean, it's funny because we were taught in medical school that if somebody had I can't remember, it was like more than two tattoos, they were like psychopaths, and it's like, wow, that's interesting,
is that why you just got two?
No, well, actually, I'm still designing the next one. So, because for me, most of this, when you're doing something this is permanent, this should have great meaning to you. So, as much as I love my wife, I'm not getting her name tattooed on my ass. Sorry, or anywhere else. People, sorry about that.
I don't think you're alone.
Okay, so it's just you're just those things. Whereas the dragon phoenix are eternal, and so they're never going to lose their meaning in terms of where they're at, and so they have such strong meaning for me. But no, most people don't don't know, I'm the doctor with the dragon tattoo, I guess. So yeah, no, tattoos are a wonderful expression of yourself. I've seen people, of course, get addicted to tattoos as well, and we don't want anything becoming an addiction per se,
Absolutely.
Personal opinion. Sorry, I'm not trying to whatever your viewpoint is, but so yeah, no, it's I think it's a wonderful thing.
Great. Well, thank you so much, Dr. Foresman, and I hope to get you back on the show to talk to you about several of the other expertise that we'd love to find out more about.
Sure. I hope I wasn't too tangential for the audience. It's such a big subject, and it's really so important because it's really it's a crucial way of looking at just aging in general and how healthy we're being, and looking at from a loving standpoint. Even if you and everybody out there, even if you're a marathon runner and you think it's not fair that you have coronary artery disease, most diseases are your teachers, and so just remember, learn from this. And it's about, there's such an important part of illness to teach us. And that's why even when you're healthy, you get some diseases. And so that seems very confusing to people, that you can be a very healthy person who just so happens to have, even a cancer or something. And so just remember, having a disease doesn't mean you did something wrong even. It's a call for attention. And look at even a diagnosis of coronary artery disease, take it seriously, but wow, learn from it, because it's such a growth. It's like, the best music comes after the breakup, right?
Absolutely.
And so why does that creative force come about? Because a challenge should bring about this force of creativity in you. And so use it that way instead of shrinking away from it, because unfortunately that happens to people. It takes them to fear. And the last thing we want is fear out there, people. There's enough of it in the world. So yes, you can be loving and intelligent about whatever entity is out there. Just learn from these things and basically embrace the journey.
Excellent. Thank you so much, Dr. Foresman. Thank you. For all the resources and show notes from today's episode, please go to www.ali.fitness. If you liked today's episode, please show your appreciation by going to iTunes, give us a 5-star review and subscribe.